Okay, let me now talk about just for a few minutes about flu shot season. So flu shot season for aging adults, what's new this year and what do I think you should know at this point in the fall when there is a lot of promotion of flu shots going on? Because there are a few new and recent developments that I think is important to be aware of. And the most interesting, exciting one for me is that this is the first year that the CDC is recommending specific flu vaccines for older adults. Now, what happens every year is that there are usually several types of flu vaccines available for adults, like usually 8 or 9. And for several years, they have had 2 that were designed for older adults, people who are age 65 and older, and are only supposed to be given to those older adults. And that was Fluzone, high-dose quadrivalent, and Fluad quadrivalent. So for the past several years, we have had those available for older adults. And yet the CDC would say, well, these are for people 65 and plus, but they declined to make a specific recommendation that older adults should try to get those, which I never quite understood why. But I don't know if it's because they were worried that maybe if you were an older person and you went into the pharmacy or your doctor didn't have those, that you wouldn't get a flu shot at all. Maybe that was part of the concern. But this year, they have actually gone ahead, their committee on immunization reviewed the data and said, okay, we are actually going to recommend some flu shots specifically for older adults. And they are the 2 that are restricted to older adults, Fluzone high dose and Fluad quadrivalent, and then one other one, which is called Flublok quadrivalent. So this one is not a brand new vaccine. It's been part of the flu shot repertoire for the last few years. It is a newer technology. I think it's been there at least 5 years at this point, possibly longer. I'd have to look to see when it first became available. But traditionally, we have made flu vaccine with eggs. They're egg-based vaccines. And then the trivalent versus quadrivalent, I don't know if anyone remembers or knew, but there used to be trivalent vaccines and quadrivalent vaccines. So that basically means whether it's engineered to protect you against 3 strains of the flu or 4 strains of the flu. Now they're all quadrivalent, which is great. So they all protect against 4 strains of the flu. And several years ago, they developed this newer technology for making the flu vaccine, which is recombinant vaccine, where they kind of cobble together vaccine proteins instead of using the eggs to generate the antigen. And the data right now has been encouraging for the quadrivalent, well, for the recombinant vaccine. It seems that they've studied it in people who are over 50, and there was another study in people who are like 65 to 75 or something like that. And it seems to do a good job of generating an immune response. They also put a fair bit of antigen in it. So the CDC, in reviewing the data, decided to add that to the list of recommended vaccines for older adults. It's available to anyone age 18 and over. So if you're not 65, if we're talking, some of you are under age 65, you could get Flublok quadrivalent, not because you're an older adult, but just because, sorry, there's a motorcycle right outside the window that's extremely noisy. Hopefully no one else can hear it. I think they need like a new engine. Muffler, that's what it is, a new muffler. Okay, so just so you know, there is also Flublok quadrivalent, which can be given to anybody who's age 18 and over, and is also now on the list of vaccines available for or is now also on the list of vaccines recommended for people 65 plus. So I would say any of them are a good choice. We have probably the most experience with Fluzone high dose quadrivalent. And the adjuvant one is a newer one, so that contains something that kind of stimulates the immune system. We do know that the newer vaccine for shingles, Shingrix, also uses an adjuvant, and that works gangbusters well. Flu and shingles are totally different conditions, so we can't necessarily say apples to apples, but but just something to keep in mind. And then the CDC definitely emphasized that any adult flu vaccine is better than none. So older adults should not get vaccinated because at the doctor's office, there wasn't one of these three choices available. They can get any vaccine that is recommended for their age group, which is basically all of them except the nasal vaccine, FluMist, that is restricted to people up to the age of 49. And for those older adults who haven't yet gotten their booster or flu shot, you can get them at the same time. You're just supposed to do a different arm. Okay. And then what should you expect for flu season? So we've been having an interesting situation with the flu these past few years. There was a lot of concern, maybe some of you remember, in the fall of 2020 of having a twindemic of coronavirus pandemic and flu pandemic. And actually that first winter after we had coronavirus, we had a very mild flu season. We had a lot of COVID, but we had a very mild flu season. And then last year, we also actually had a pretty mild flu season. Now, what was funny was that last year we had an unusually late spike in April and May when a lot of flu started going around. But compared to other years, or what we would consider a severe flu season year, I think 2017 to 2018 had been a severe flu season year. Last year was not so bad. Now, what is going to happen this year? So we might well have a severe season this year. Some experts are anticipating that. Usually we make our predictions for the Northern Hemisphere based on what happened in the Southern Hemisphere for flu. And in Australia, they just had their worst flu season in 5 years. They had quite a lot of flu and it started early. So a lot of experts feel that, and I think there's something to be said for this, that we should sort of err on the safe side and brace ourselves for a potentially bad flu season, which means get vaccinated and monitor for flu. But we will see. So let me show you really quickly a place where you can look throughout the fall to know what is going on with the flu. I think it's a great resource. And what is kind of cool is that the CDC for a very long time has tracked not only confirmed cases of influenza, but what they call influenza-like illness, flu-like illness. And the thing is, COVID symptomatically is like a flu-like illness for many people. So this view now is also showing things that could be COVID. And okay, so this is the new or newly updated. We've had this article on Better Health While Aging for a couple of years. So this is pretty in-depth, gives you lots of details about the flu shots and the history of flu and how flu works. And I think we have somewhere here the data on how many deaths we usually have from flu. I will tell you, it is way fewer than COVID. I think the estimate for last year, I have it somewhere down here, is, I'd have to look. It's less than a bad flu year. However, we have already had 200,000 people die of COVID since January 1st this year. So we don't want to underestimate the flu, but you know, we have a lot of people still getting sick from these respiratory illnesses. And the thing about these respiratory illnesses is that the same things can help protect you against them. This is part of why they think we've had weaker flu seasons, is the masking and social distancing. Now, we don't want people to be socially isolated. It's crippling. It's especially bad for older adults, but we can also be mindful that many of the strategies that help reduce COVID risk, like ventilation, and maybe being a little bit more careful about indoor gatherings when rates of COVID or respiratory illnesses are high, that's going to protect you against both flu and COVID. So this is, I will share a link to this in the replay notes, the CDC Flu Weekly, but this is where you can see kind of how the flu activity is looking. They have a very weird method of counting weeks. They don't put like the month, they give them numbers. If you look for the CDC MMR weeks, you can see what they correspond to right here. So you can see right here, week 15 was mid-April. And that was like right here. See, I was saying that we had a late spike of flu. And we really did. This is April, May, right here. So here we are right now. And you can see we had a low here, week 32, which was in mid-August. And now it's starting to come back up, but not high yet. Now, it takes older adults, I mean, we say 2 weeks. Older adults, we know it takes them longer to respond to a vaccine than younger adults. So to be on the safe side, 4 weeks. So you don't want to be waiting until flu cases are high before you get vaccinated. I think now is a great time to be vaccinated for the flu. But just so you know, we are not yet seeing a lot of flu activity. But I think it's good to prepare for the possibility. This and this here shows you the percentage of outpatient visits for respiratory illness. And so you can see we're a little higher than we were like 4 weeks ago, but not sky high. A lot of that increased illness is actually being driven by children. So you can see it right here. It's the very small children and then the school-age children. That is probably related to back to school, and then they have a little geographical map. So I think that's a cool resource to keep an eye on for this fall. Okay. So just to finish off with a brief recap of my vaccine recs, I do recommend flu vaccine for everyone. It is most likely to prevent hospitalization and death in older adults. Same as with COVID vaccine. And I think when the rest of us get vaccinated, we potentially reduce flu transmission, and that helps protect the most vulnerable people among us. So I am going to go get my flu vaccine, I think this weekend. And I recommend it for everyone. And then older adults should try to get one of those 3 vaccines that is now, for the first time, specifically recommended for them. And then I talked about the booster 2 weeks ago, and I also have a more in-depth update that's posted on our YouTube channel. The booster, the older you are, the more of a difference the booster makes. So I strongly, strongly recommend it for everyone over age 65. And it's important to make sure that people who are in assisted living, in nursing homes, and what we call kind of congregate living, that they get it. Now, if you're, I think you can go either way if you're, especially if you're under 50 and 50 to 65, just so you know, everyone kind of looks at the same data, but in most European countries, they are only doing the fall booster for older adults, either people over 50 or over 60 or 65. They're doing it for those groups, for pregnant women, actually, because it does seem to really make a difference for pregnant women, and because women pass it on to their babies. And that seems, their newborns, and that seems really relevant too. And then they offer it to people who are immune compromised or have severe health conditions. So my strongest recommendation is for the older adults. And if other people want to get boosted, I think that's fine. It's available to all adults. Here, it's just likely to result in a temporary, like 2 months reduction in, little diminished risk of catching or transmitting COVID. And right now, COVID cases are low. So I think whether you're boosted or not isn't going to make a difference to transmitting COVID for younger people. And then later, when COVID cases go up, and there's a good chance they will go up in the winter time, I don't know that your booster is going to make a big enough difference. I think then if we want to reduce COVID, we're going to have to think about the non-vaccine mitigation strategies, masks, ventilations, being careful in indoor spaces. So those are, that's my little update on flu shots and your fall vaccine public service announcement. And so now we are going to go into question and answer time. Okay, hello, this is Dr. Kernisan, and actually there will not be any question and answer time on this video, but I want to thank you for watching this flu vaccine update. I presented it as part of a regularly scheduled Helping Older Parents Q&A coaching call on September 22nd, and then I went into the scheduled Q&A with that group. If you are curious about those calls, I have been running Helping Older Parents online programs for the past few years, and through those programs, I get on live interactive Q&A calls twice a month, and I answer people's questions about their aging parents. And also, I sometimes present a little bit of information about new things going on, like the flu vaccine, COVID, or anything else that I think would be helpful to the group. If you would like to learn more, I'll post a link in the description below. You can visit betterhealthwhileaging.net/helping-older-parents for more about those programs. Otherwise, for more aging health videos, please subscribe to our YouTube channel. Thank you, everyone. Take care and get that flu shot.